Our next pitch is Docpace from Metairie, Louisiana. I think I got that right. Docpace is the ultimate pre-op and pre-app management solution for healthcare professionals. The Docpace product helps medical staff streamline the process, increasing case and appointment volumes, improving patient satisfaction, boosting efficiency, and decreasing cancellations. Docpace is revolutionizing the pre-app and pre-op journey for patients through communications. The floor is yours, Docpace.
Thank you. It's an honor to share with you Docpace, your front office AI. I know we have all felt this pain. In fact, working Americans spend 17,000 years waiting in the waiting room annually. But what I'm here to tell you today is that the problem is even greater on the other side of the check-in desk. Staff are overburdened with managing patients during the pre-appointment process and trying to keep schedules running on time. Hi, I'm Shelby Sanderford, and I'm on a mission to reduce wait times, eliminate the need for waiting rooms, and ultimately revolutionize the way patients and staff experience the appointment journey. Our unique approach to solving patient problems is by thinking about the staff first. What's missing from every front office is an AI office assistant that works overtime, doesn't take breaks, and never gets tired. Docpace is a front office AI solution. With the use of historical and real-time data, our algorithms are able to predict ahead of time how the day will flow so staff know what to expect and patients can be auto-updated in real time. With Docpace running your front office, staff are alleviated of tasks, saving the practice time and money, and patient engagement and communication is improved. Our seamlessly integrated solution was designed so that staff are always in the know with schedule logistics, updates are shared with patients automatically, and you learn how to eliminate bottlenecks and improve your operations. Our approach to solving wait times isn't just a Band-Aid solution like other real-time update services. Our analytics is unveiling the root cause of these delays so that we can prevent them from ever even happening. This approach allows us to help providers maximize their billable hours without working extra hours. Most of the competitors are in the virtual queuing space for walk-in appointments, and others are focused on e-paperwork and payment. In the U.S., there are approximately 1.2 million providers. Our solution is applicable to any practicing provider and can work with any EMR. To focus our sales efforts with limited resources, we're currently focused on the Athena Health market, which has about 160,000 users. We went live with Athena in May. We are currently live in several practices and already seeing success in a short period of time. Plus, in the last 30 days, we've added almost 100 prospects to our sales funnel. We follow a standard software pricing model and charge $99 per month per provider. Our projections show in 5 years we will hit $38 million in revenue. We have an incredible team with over 70 years experience. To date, we have been focused on outpatient appointments, but we see tremendous value in bringing the solution to the perioperative space for inpatient appointments. In addition, there is opportunity for utilization with clinical trials and patient communication.
Your 3 minutes were up. So
yeah.
So great job, Shelby. We'll turn to our panel for Q&A, and I think Larry, you've got the first question.
Yeah, no, Shelby, I really wanted to ask you. Your presentation was great, and I remember when I was in practice, a tool like this would have been very helpful to get a dashboard overview of my flow. But how does your system integrate into, say, Epic or Cerner? Or is a thought like to license to them? And what is sort of your long-term play, considering that there are several really major players in the EHR space that all could offer something similar as an add-on to an EHR the doctor already has?
Yes, so great question. And we do integrate into the scheduling systems that are already existing in these practices. We're always thinking about how to reduce the workload on the staff end. So integrating allows us to automatically pull all the information that we need in order to run our system. So we're looking at over 50 data inputs that all could potentially impact delay time. And that's what runs our algorithms and keeps the day updated and on track.
Very good. Amy, I believe you have a question.
Nice job, Shelby. Question, what types of practices have you trained your models on? So, each type of practice tends to have, based on specialty, different run a show, so to speak. And so just curious how you've trained your models and what sort of data you used.
Yeah, so we've looked at various specialties, primary care, OBGYN, ortho. What we do when we do an onboard is actually study the schedule beforehand because, again, we want to reduce the workload on the staff end. So we adapt to their existing workflow so that we don't have to alter their behavior. So it does work in various different specialties.
Very good. Josh, you have a question?
Yeah. Hey, Shelby. Quick question. Like, what are the one or two things that you feel like you need to go do in order to realize the growth that you had on that previous page?
Oh, we took into account, so we're looking at doing 2 new integrations per year, new schedule systems. And we also, one of the main drivers of this is the average number of providers per practice. And that's what's driving this model. And we've actually used an incredibly conservative number 3.
Great. Brian, I think you have a question.
Yeah, thanks, Ken. Great presentation, Shelby. In terms of your AI usage,
Yeah.
are you heavier with natural language processing, machine learning, or deep learning? Or are you, and then in terms of today versus where you see yourself over the next couple of years with the product?
Machine learning, so I think I understand your question of, we're using both historical and real-time data to run our machine learning. Yep.
Machine learning, okay. Great.
All right, that was the last question. I appreciate it. Great job, Shelby. Outstanding.